Hi everyone, welcome back to my channel. How are you doing? Okay guys, today we are going to be talking about pressure area assessment. Okay, and then on this station is just about 8 minutes station. All right, you will be given an answer sheet and also a question paper for you to write your answer. Okay, and you are going to stay quietly because it's a silent station. Now you'll be getting like question like, what are the signs that shows that pressure soil wants to develop? What are the areas for pressure soil development? Yes. The first one is, what are the signs that pressure soil wants to develop? Now, I have an acronym that is going to help you to write effectively because you are required to write eight, eight signs that shows that pressure soil wants to develop. Okay, so the acronym I have on this is PBDL. PBDL. P is raised to power 2, persistent erythema and purplish discoloration of the skin. Okay, next one is B. B is just one. All right, which is blister. And then another one is D. D is just one, which is discoloration of the skin. And then we have 4L, which is localized induration, localized heat, localized coolness, and localized edema. You have 8. And then the second question says, what are the areas of pressure soil developments? You are going to write 8. And I have an acronym known as BEST. B raised to power 2, which is buttocks and back of the head. Next is E is raised to power 2, ear and elbow. Next is S raised to power 3, sacrum, spine, and shoulder. And next one is T raised to power 1, which is your toe. Toe. Okay, you see how simple is it? And then after this, you're now going to do the next one, which they are going to show you, give you a chart like this, the one on the screen, which have about 6 parameters: sensory perception, activity, moisture, mobility, nutrition, friction, and shear. And they're going to give you a clue on your question so that you can be able to pick up the number this patient is falling in. All right, and this chart is known as Braden scale. Yes, that's what we use to assess our patient's pressure area. All right, so you just follow it according to question they gave you. You can be able to pick up your answer from the chart, which after you total it to know if the patient is under low risk, under moderate, or under high risk. All right, and that is it. Remember that this chart is going to be marked. That is it. Okay, you put your signature and the time of your exam. Yes, and then make sure you are writing your name in full. They're going to give you a space where you are going to write your name on your answer sheet. Okay, that is it for this examination. And the best advice I can give you is make sure you are doing the first part, which is the signs that shows that pressure area wants to develop and the areas for pressure soil development. You are doing it just within 3 minutes. That is why it's good for you to know this acronym, because it's going to help you. You are doing it only for 3 minutes. Immediately you finish it under 3 minutes, you now use the remaining 5 minutes and focus on this chart. Yes, it's as easy as ABC. Okay, I wish you all the best in your OSCE preparation examination. Just keep doing the right thing, use your marking criteria, watch videos, practice, practice, and practice. And with God, I believe you are going to pass your examination at first sitting. Okay, Congratulations, my beautiful nurses, for staying this far. I love you. Thank you so much for watching my video. Still remember to comment, subscribe, like, and share to all the beautiful and wonderful nurses out there. God chicks love you all. See you on my next video. Bye.